Let's Talk Nursing is brought to you by bjninform.com, a learning platform for bite-sized, evidence-based content that supports all aspects of nursing. I'm Samina Hashimi, editor of BJ Inform, and in each episode I chat with experts about topics across person-centered care, nurse well-being, and career development. Together, we'll explore their experiences and discuss practical tips and insights that you can apply to your nursing practice. Hello and welcome to the final My Career episode of this series of Let's Talk Nursing, the BJ and Inform podcast. Today I'm joined by Barry Hill, Professor of Nursing and Head of the School of Nursing and Midwifery at Buckinghamshire New University. He's part of the university executive team leading the strategic direction and development of the school. Throughout his career, Barry has been committed to improving student well-being, reducing attrition, and enhancing student experiences, particularly in relation to the National Student Survey. Thank you so much for joining me, Barry.
Thank you very much, Samina. It's great to be here talking with you today.
So in this episode, we're talking about the barriers and challenges that are faced by students in pursuing nursing as an educational and career pathway. So at a time of sort of record low student nurse recruitment and record high attrition rates, it's probably more important than ever to talk about the causes behind these trends and the potential solutions. And all I've been seeing lately in general media around student nurses is the plummeting rates of university applications and increasing attrition because of things like stress and burnout. So clearly the overall picture of student nurse attrition is not looking great, but could you give a bit of a background on what the actual trends in student admissions and retention rates are looking like at the moment?
Yeah, I think you're absolutely right, Samina. So in recent years, the landscape of nursing has changed quite dramatically. So I think from the information we have from UCAS, it suggested about a 9% drop in applications in 2023. But there's been lots of worry really since going back to about 2017. We saw around that time that there was a cut after the bursary had been removed around 30%. So there was this huge reduction in applications, and this caused a big issue within applications for our programmes. And really, since then, the only thing that's been added in is this £5,000 annual maintenance grant. So it's never really remedied this situation since then. I think beyond admissions, our attrition rates are, really complicated. So we have around 25% of our nursing students that don't complete their degrees overall. And some universities are experiencing higher dropout rates, even up to about 33%. So these kind of high attrition rates are driven by lots of issues, particularly, I'd say, financial strain on our students, but also mental health, poor health, alongside, being tired from these clinical placements and other types of things that cause intensity in, just being a student on a program that's so complicated. The nursing programs, as you know, they're 2,300 hours of theory, but our students also have 2,300 hours of hands-on clinical practice. And this makes the degree twice as hard to achieve. Not only are they trying to get a BSc honours nursing degree, they're also trying to get their NMC qualification. So it's a double win if they get there at the end, but it's also double hard work to get there. I think COVID's been particularly challenging. It's caused a lot of confusion within nursing programs. We had this massive surge in applications around the time of Clap for Carers and Nurses at Angels. But that kind of increased our applicants by about 20 to 30%. And then more recently, we've had this drop of about 20 to 30%. So it's kind of had a real bell curve moment, and then it's reduced after that, which has been quite tricky. I think clinical practice areas, they are working really hard to support our students. So there's lots of practice supervisors and practice assessors, but it's a real hard time within clinical practice, lots of challenges, funding challenges and so on. So students are caught up in that. So I think some of those things are the things to consider in terms of some of the main barriers. And I suppose the last thing really to mention is the NHS Workforce Plan. So this was published in 2023. And really, it's looking over the next decade and sets out how the NHS intends to address all of our staffing shortages, But what they have said in this document is that they promise to double the amount of medical schools places, for example, spots for nursing degrees, and increase nurse training by about 50%. So that's a really big suggestion that they've made. And this falls on the shoulders of higher education institutions as well as clinical placement areas to make this happen. And so that is a bit of a concern, with our reducing numbers at the moment. How are we going to achieve this? What things can we put in place to help our students or applicants get onto these courses and be successful? And it's not only about getting onto the programs, it's about achieving and completing the programs and being, ready for genuine practice once they've completed.
Yeah, thanks for outlining that. And those trends that you mentioned earlier are really quite extreme. I mean, up to 33% attrition rate is really quite negative, especially in the context of, so many staff shortages and especially nursing staff shortages in the NHS. And you mentioned that the admission rates dropped significantly after the removal of the NHS bursary. Clearly, financial issues play a big role in reduced admissions, but could you expand a bit more on the main barriers that are preventing people from, pursuing nursing education?
Absolutely, Samina. Yeah, you're right. So the financial and practical barriers are two of the most significant factors we've seen in terms of our students pursuing their nursing degrees. I think that the high cost of the tuition, that's around about £9,500 at my institution, and this removal of the NHS bursary in 2017 has always been problematic. But it's not the solution, because I know I've spoken to colleagues that work outside of England. So they work in other parts of the UK, Wales and Scotland, where bursary is still received, and there's still a reduction in student numbers and there's still attrition. So by no means is the NHS bursary the only solution. However, it is an option within the English, student nursing group. They do struggle a lot with finances. They end up with a lot of debt. I think, although the government have introduced a £5,000 annual training grant, and that was probably around 2020, it's not enough to cover the living costs for many students, especially in regions where rent and other expenses are really high, particularly London and the South East. Nursing students are also unable to take on traditional part-time jobs because 50% of their programme is hands-on clinical practice. So depending on the type of programme they might do, they might be on placement every week with a couple of university days every week, or some other kind of versions is that people would do 5 or 10 weeks at university and followed by 5 or 10 weeks full-time placement. So they don't have the same opportunities as other types of students. So when you're thinking about widening access and participation, these challenges are really significant for mature students or those with families or children. They might have significant childcare or financial support needs that we need to recognise in order for them to train as nurses. And these are true things to consider because we're thinking about the impact on retention, as students in these situations are more likely to withdraw from the programme due to things like, accumulating this strain and this pressure. On top of that, I think thinking about things like emotional and physical demands on our nursing students, there's lots of barriers. Look, the clinical placements are integral to nursing education, but they are overwhelming for students. Particularly first years, they might go out into a high pressure environment, dealing with emergencies or end-of-life care, for example, and they don't know how to process their feelings. And this might then make them think, is this the right career for me? I don't know how to manage my emotions. So there's a few things there that can potentially lead, to struggle or burnout. And then, there's lots of things around placements and the kind of the acuity and the type of placements students are having, because they love their placements. It is 50% of their programme, but they have a real variety of different placements. It's making sure that we have the theory practice links and making sure they're having high quality placements, not just the hours, but actually making sure that the quality is within those placements and they're getting what they need to get from those placements. And I think just to kind of finish off on this bit, just to bring in a little bit of political argument, the Labour Party has made quite a few promises for our nursing students. So it's worth noting that they've said that nursing students are really important. They talk a lot about the kind of healthcare workforce, and they have pledged to double the number of students and midwifery, nursing students and midwifery students, if and when they were elected, before they were elected. And they also promised to reinstate, things like the NHS bursary or some type of options for students so they're not so financially unenabled, really. So they've got quite a lot of work to do if they're going to stand up and keep their promises for our students. So I suppose I just wanted to bring that in because I know that a lot of public health workers have brought in Labour and they want them to fix the NHS. So it's just to say that there's a lot of work to be done at this point.
Yeah, no, just going off the back of that, your political point, it might be a bit too early to ask you this, but have you been seeing any positive changes since the government change in terms of, improvements in the field of nursing specifically? And also, are there any policy changes aside from the ones that Labour have pledged to make that you would want to see implemented?
Yeah, there's some good questions. So nothing as of yet, nothing immediately that jumps out. But I do know from my own experience that the Labour MPs are being really good in terms of working with HEIs. So we've had, in terms of our university, we've had one of the MPs visit the High Wycombe campus and do tours, meet the staff. And we've actually got one for nursing and midwifery in Uxbridge this week on Friday, where the local MP, who has replaced Boris Johnson, who used to be the MP for Hillingdon, is having a tour and meeting with student nurses and midwives to have a conversation about the local needs. So I think there's lots of work for them to do. I do think that they are trying to come out and meet the community and honour their commitments, but there's nothing immediately changed as of yet. I think it will take a bit of time.
Yeah. And in terms of other sort of policy changes, are they kind of pledging to meet everything that you think is important, or are there other things that you think they should be working towards achieving? Maybe not immediately, obviously there's a long to-do list there, but, in the future.
Yes, yeah. I think there's lots of things politically driven. It all comes down to money and that kind of infinite King's Fund and having fees available. But I do think we need to probably consider where our nursing workforce is coming from. So there's been a huge reduction in home applications across the country, and there's been an increase in international recruitment. So there's lots of things to consider in terms of workforce and also how long the workforce is going to be available. So what I mean by that is registered nursing is just one of the old terms we use. We have nursing associates. We also have different types of healthcare support workers. We have different types of apprenticeships, degrees, pre-registration master's programs, advanced clinical practitioners, enhanced practitioners. So when you're looking at a whole range of different role types within nursing, or traditionally has its roots within nursing, the government need to support some kind of clarity around how our scope of practice is being measured. There's lots of things going on within the healthcare landscape. You have physicians associates, you have advanced clinical practitioners that are accredited by non-nursing groups. So there's lots of things kind of coming under the guise of the GMC now, the General Medical Council, rather than the NMC. There's different roles that are being advertised. So I think for me, what the government need to support is some kind of understanding of how our roles are viewed and how we can maybe enhance how nurses and midwives work rather than changing the title and making lots more different titles. Looking at the kind of journey between how the nurse enters the workforce and the scope of practice they can end up with. Because we are moving towards this advanced clinical practitioner route, which is very generic. You can be a physiotherapist, you can be a nurse, you can be a midwife, you can be lots of different professions. And that's made things a little bit more unclear. Although I do advocate for ACPs, I did a master's in advanced clinical practice myself. I do think that there's room to enhance and refine some of the pledges they're making within the NHS plan.
Yeah, no, even just hearing you list all of the roles and all of the departments and things like that, I can imagine it must be really confusing for someone already working in that area, but, let alone for a student nurse who's trying to figure out their career path. And I also read recently sort of the state of the NHS and it being so challenging to work in that environment also then affects students' perceptions of what their careers will be like when they're on clinical placements. So I guess improving the NHS structure and, the state of the NHS as a whole would in turn then have an effect on students. Would you generally agree with that? Or
I would, yeah. I think even with things like Agenda for Change, as it was, when we think about banding and how nurses come out as a band five, there's some professions that will come out as a band six, and then what those mean and how they're put into Agenda for Change, all of that is confusing because if you're going to elevate the level of practice and scope of practice for professionals, registered health professionals, then it needs to be levied out with the kind of pay band they're at. So I do think it's a very confusing place, but it's also full of opportunities, I would say, which is phenomenal. It's absolutely amazing the amount of things you can do as a nurse and where you can take your career. So that's the flip side of the coin.
I guess it's just knowing how to navigate all of those slightly confusing role names to really take advantage of it. Yeah. And obviously we're talking about sort of traditional university degrees here, but there are other routes into nursing that don't necessarily involve a university course per se. So could you explain what the alternative routes into nursing are and what are some of the challenges or barriers that people might experience through those alternative routes, or conversely, are they actually more accessible than the traditional university degree?
So you're right. So there's lots of different ways you can get into your nurse education now. So typically speaking, most students would do a UCAS application and they'll do a traditional BSc. So it's a Bachelor of Science with honours, which just means it's got a dissertation attached to it. And that's typically 3 years long. There is an opportunity for students to RPEL so they can recognise prior learning, or there's also APL or APCL, which means you can have certified accreditation. So if someone's done maybe their first year in a different university and they want to move because something's happened, they can then miss their first year, have that RPEL'd in, and then do their second 2 years somewhere else. So there are opportunities for the traditional UCAS BSc entry. But what's more popular these days is being employed to do your nurse training instead. So the apprentice route is much more popular. I think apprentices tend to have lots of challenges because they are employed. They have, employment terms and conditions that a student nurse wouldn't have on a UCAS BSc entry because they are never an employee. They're always a student in a learning environment. So that causes some challenges. But what apprentices do get is they get a full-time salary. They are based within an NHS trust typically, and they will be supported by people they know when they're doing home placements, but they also get external placements as well. But I think a salary in terms of, not having course fees, not having debt and so on, and having the apprenticeship levy cover most of the costs is a real benefit. And when you have that kind of versus a traditional UCAS BSc entry, typically speaking, they're not going to have anything less than £50,000 worth of debt. And that's quite challenging when you're having this debt because that's seen when you're applying for mortgages. That comes up. It's part of your kind of package as a human. But apprenticeships are brilliant. They are really fantastic. They're more flexible, but they are much more competitive because people want to have a salary. Apprenticeships would be amazing if they were offered across the country, or if, and I'm obviously a nurse speaking at the moment, if they could remove the course fees for students doing any health professional programs because they are public services and we need them. It's not a choice. We need nurses and midwives. We need GPs. We need everybody. So it's just a consideration, really, what could be done.
Ideally, there'd be no tuition fees and a full.
In an ideal world, I know.
Bursary.
Blue sky thinking, I know.
Mm-hmm.
But if we're talking about things, the solutions, I just think the elephant in the room is always it's the cost. People can't. If people are doing placements all week and they're at university full time, then they can't work. And if they can't work and they've got children, which most of our students, if you look across the country, they tend to be considered mature students. So they're over the age of 21. And it's just financially, it's very complicated for them.
Yeah, definitely. And what is the bursary at the moment? Like £5,000?
Yeah, so there's no bursary in England, but there is this £5,000 grant. So
Grant, yeah.
you get to keep it, but it's, if you think of it like this, it's less than London waiting. If you work centrally,
Mm,
you can get up to £6,000 London waiting, and that's supposed to cover the trains and the price of a coffee, really,
just the bare
in London
minimum
in the
stuff,
south.
yeah.
You know,
So I can see how the apprenticeship would be a really appealing sort of solution to that. But again, like you said, the competitiveness means probably only a few people can really take advantage of that.
yes, yeah. I would say though, just to flip it over, because I like two sides of the coin.
Hmm.
To do nursing, because there is a lot of challenges, but I think to be a nurse is such an amazing career. You get to be with people that you would never see in your day-to-day life. You get certain permissions that you'd never have as a person on the street. You get insight into people's lives, you connect with families. You get verbal, non-verbal communication, touch, appropriate touch, things like that, where people feel your compassion and your genuine kind of desire to make them feel safe. And it's quite a humane, it leads towards humanity. When somebody feels safe and looked after, and they've met someone that they can depend on just for the stay, whilst they're there, it's really important. As a charge nurse in intensive care, the things I was exposed to were significant. And it's on both sides of the coin. You see vulnerable staff dealing with pain because they're looking after someone with a trauma or organ donation, and it's really challenging. And then you see families that let you into their space and have a moment of connection with them in clinical practice. And they're the reasons that you stay in nursing practice and don't leave. Alongside the challenges are the rewards, I'd say.
No, I'm really glad you're sort of highlighting that flip side of the coin because I think when you're talking about challenges and barriers, it's really easy to get bogged down in all the
Yes,
negative details. So,
yes.
yeah, no, that's amazing. And sort of going on this positive trajectory, what are some of the potential solutions to the challenges and barriers that student nurses are facing?
So I think we really need to have this comprehensive approach. So it needs to be joined up thinking between the universities, so the HEIs, and also the organisations, whether they be NHS or private organisations. When we're thinking about policy change, it needs to be collaborative, make sure everybody's sitting at the table and having the same conversation. Personally, I'd love to see the introduction of the NHS bursary and course fee waiver in England. I don't think it's the only solution, but I do think it's helpful because this would relieve some of the financial burden that our students are facing. And like I said earlier, those that are working part-time jobs on top of placement and full-time study are just burnt out. And that's one of the key reasons for our attrition. I think in addition to financial support, we need to think about placement hours and we need to think about the quality of our placements and the role of practice supervision and practice assessment with our new standards. So just making sure that these are right and that students feel as though they're getting the right amount of support. I know that our students tend to have a lot of mental health concerns, and so what universities and health providers are doing is they're building on their mental health and wellbeing support services. So all of those types of things are available to students, which, much more so than when I was a student. So, for example, they brought in roles like the professional nurse advocate. So we've got P&As now in organisations, and they've been very helpful. But they are trained really to offer restorative supervision and support nurses facing challenging work environments. So there is a place for the P&A role, and there's also one for midwifery, a PMA role as well. But I think they're the kind of things that we're looking at and some of the solutions we need in terms of helping our students through their barriers.
Definitely. And as an academic, I'm sure you've had many personal experiences to do with handling the challenges that students face. So, what in your experience have you found works in terms of recognizing these challenges and overcoming them?
Yeah, so it's a good question. I've got a couple of examples, I think. So the first one would probably be we did a project that was called the Repair Project, which was brilliant, and it was Repair stands for reducing pre-registration attrition and improving retention. But this was a great project, and funnily enough, I did publish this work open access in the British Journal of Nursing. Just a bit of a prompt there, but it is available to read. But the project itself was designed to explore the causes behind our high attrition rates within our pre-registration nursing programs. And what we tried to do is develop some practical, actionable solutions to support our student retention. And it worked really well. We did identify several different recurring issues for student attrition, and they're typically the ones that we've spoken about already, but it was financial pressures, emotional stress, particularly within placement areas, and difficulties adjusting to academic kind of rigor of nursing programs. We also found that students within their narratives spoke a lot about feeling isolated, particularly during placements, which made them more likely to disengage with their studies. I think one of the most kind of impactful strategies we had was around early intervention and ongoing support, particularly around our first year nursing students in their training. So we tried to introduce some measures to support our students. But what we did find is, at this particular university that I worked at, we had 135 interruptions from a program, and mental health accounted for more than 90 of those students that had attrition. So we built this summer school, and we supported students to have lots of interventions. Lots of them were linked to mental health support, but also re-engaging with nursing as a subject. And it was just an open window. So we made contact, spoke to the students one-to-one, and also offered them the summer school. So that was really, really good. So I suppose what I learned from this repair project that we did, that it was very multifaceted. It did support this improvement in student retention, the financial support, proactive engagement, emotional well-being. All of those things were improved for the students that we engaged with. And it kind of reinforced my belief, I suppose, that early, consistent support is really effective and probably the most helpful thing we can offer students so they overcome these barriers that they're facing. And that particular project went forward for the Times Higher Education. It won the Outstanding Student Support Award. So thumbs up to Northumbria
Amazing.
University for all of the work they've done to support students. That was a really good project.
Yeah, no, that sounds fantastic. And I think just maybe this is just clarification for me, but you mentioned that there were sort of interventions. What kind of interventions were these?
Yeah, so there was lots of different things. So we had so one of the things we did was called Skills Fest, and it was led by Dr. Claire Ford, who's fantastic. And what we did is we basically had rotations of lots of different proficiencies within the NMC proficiency lists, Annex A and Annex B skills. So we offered a whole range of different skills to students returning so they could practice in a safe space. We also had a writing workshop where students who hadn't been on the programme for a while, they were worried about kind of academic practice. We could talk to them about how they can write in level 4, level 5, level 6, so kind of year 1, year 2, year 3, the difference between description, evaluation, and critical analysis, for example. We also invited in some of the clinical practice assessors to speak to the students and other things. So there was quite a few things that happened. There was some pottery classes where students could just get together and be engaged with some kind of art. So it enabled them to have a safe space to speak together, make something. So it wasn't just about tasks, it was about being as well. So the kind of art and science behind why nurses want to stay on their courses and, get to the end and achieve, really. But it does, so this project did end up leading to another project. So we ended up doing another project, which was led by Dr. Tor Alexander Bruce, called the Wise Room Project. And really what it was looking at is how we could develop a room that would support students from their attrition. So the first project was about getting them back on their programme. The second project was to prevent them from leaving. So what it did was it was an intuitive room. I don't know if you've seen them before, but they're these big immersive room spaces where you can have videos on the wall. They're touch sensitive. You can have sound and you can have smells. And it's all about immersing somebody in an environment. But what was done was we developed a whole host of different rooms so students could use these rooms to kind of debrief, particularly if they've had challenging shifts or challenging conversations at university. It also supported things like access to mental health and engagement and discussion with their peers. So, for example, some of the rooms within the WISE room were pharmacology. So they were around making drug errors and learning from drug errors and having a debrief. One of the rooms was around end-of-life care. So if they dealt with end-of-life care on their clinical shift, and needed some support, they could go into the WISE room. And the reason being, the WISE room is somebody with lots of experience that could debrief them and help them deal with or cope with the challenge they'd faced, really. And the team have embedded some of these rooms within their curricula. So that's been really helpful. So again, example one is bringing student nurses back onto programme. But example two is making sure we do things so they don't leave and trying to catch them before there is any attrition. As
And
much
I
as
think
possible, yeah.
as much as possible, yeah, for sure. And I think that sounds really amazing because it's sort of a holistic approach to this sort of attrition. I feel like I'm talking about patient care,
Yeah,
holistic patient care, but I mean, it's a similar concept, isn't it? Sort of creating this immersive room that provides debriefs, but is also sort of interactive and a bit more interesting in that respect.
absolutely.
Oh, thank you so much for those fantastic examples. I think, yeah, they're just really good examples in terms of both recognizing the challenges that students are dealing with, but also thinking about how can we go about solving these and making the student education journey as smooth as possible. Now I'm going to ask you about your three key actions. So these are three important practical actions that you would recommend nurses to start implementing. And this can obviously include student nurses, academics, or practice nurses. So what is the first key action that you would recommend?
As always, I'll start with the students because they are so important. So I think for students, it's actively seeking support early. So students should be encouraged to be proactive, like I said before, and seek support from their personal tutors in the first instance if they're at university. But if they're out in clinical practice, they should make sure they contact their practice supervisors. But regardless of where they are, they should always think about wellbeing services, particularly when they're facing challenges, which they will do along their journey. A lot of our students have babies, life events happen over a 3-year program. It's a long time. It's just making sure you know how to get help if you need it. I suppose this ensures that any issues, whether they're academic or personal, they can be addressed before they escalate, making sure that we kind of reduce their stress and make sure they feel that they're being supported. So that would be my kind of top action for students. For academics, it's really around enhancing clear communication, particularly on assessment and placement expectations, because these are the things that students typically are most stressed about. So, academics should always ensure that students fully understand the assessment criteria, whether that be an academic written piece, an OSCE, like a clinical OSCE, or something in practice, so proficiency, but making sure they understand it. So just really provide clear, accessible resources, have regular check-ins with your students, make sure they're confident and prepared, especially when they're navigating complex assessment frameworks that we sometimes have in place for our students. And then my final action would be for practicing nursing. So I suppose those that are clinical, some are non-clinical, but if they're working within health outside of the university, it's really making sure that there are supportive practice supervision within their environment, really. So as it always typically is, making sure that the engagement is open, that the environment is welcoming for students, and also recognising that our students are students. They're not employees. They are actively working in the areas to learn, but they don't get a salary. They don't have terms and conditions, and they're not employed. So I suppose making sure that we understand they're in a learning environment and that it's structured and supported and guidance is offered and encouraged. And really, I suppose one of the top things that comes back from our students is about reflection. So making sure there is a reflective conversation at the end of a shift or a debrief so students understand that the way they're feeling is normal and how they can go home and not think about work. What kind of things do experienced nurses do and experienced supervisors to kind of offload before they go home?
Amazing. Thank you so much for sharing those and yeah, for highlighting actions across sort of students, academics and practicing nurses as well. So everyone really has something to take away. And now to wrap up the episode, we're going to look at a couple of scenario-based reflective questions. So I'm going to read out two scenarios that a student nurse might encounter, and we'll then discuss how you would approach these situations. And for our listeners, feel free to pause the episode and think about what you would do or would recommend a student nurse to do in these situations, and then press play to hear Barry's response. So, the first scenario is you're on placement in a busy hospital ward and you notice that a fellow student is struggling to keep up with the workload and is frequently making small errors. You have completed your tasks for the day and want to offer support, but you're unsure of how to approach the situation without undermining their confidence or interfering with their learning experience. How would you offer support to a fellow student on placement who is struggling with the workload while ensuring you maintain a respectful and non-judgmental approach? So, what would be your advice to a student nurse who might find themselves in a similar situation?
Yeah, thank you, Samina. So my model answer would be that if a student is struggling with their workload, is to make sure that we kind of depict it and break it down to find out what exactly is it that's a problem, because you tend to find it's something really simple. As a qualified, experienced nurse, there's things that we can support, and build in these coping strategies. So, for example, some people might find the workload really difficult because they don't understand how to calculate medications. So it might be that we just do a small calculations overview with the student. It might be that they don't really know how to communicate well in a particular situation. So we can have, an example together and say, well, pretend I'm the patient or I'm the patient's family member. Speak to me and let's see if we can resolve this. So it's really, rather than having a kind of you're not doing things right, this is a problem attitude, it's really about thinking, well, this is a learner in a learning environment. How can we approach this respectfully and give them some examples? Because that really does help build a relationship with the student as well. And they're not so scared about the learning experience because we all learn by doing. Offer them examples, offer them a kind of sounding board, and show them the solution. Because what they'll do as first years, particularly, is they will either describe or they're copycat. And then it's not really until you get to the end of second year, mid third year, where you're leading and managing patient care. So it's really making sure our expectations are at the level of their practice.
Yeah, definitely. And I think it's just a sort of interpersonal human interaction as well. I mean, I know I, for one, respond much better to positive feedback than negative. I mean, obviously, we all need critical feedback sometimes, but, just creating that positive learning environment, I guess. I don't know. Would you say
Absolutely.
that's,
Yeah,
yeah.
you're right. And the thing is, there's ways of doing things. It's with university feedback, we always try and sandwich feedback. So things that are positive go first, things that could be improved go in the center, and then we finish off with one of the strengths. A bit like, when you're writing an article for the BJN and you're submitting your work, you want that feedback to be something that's positive. And even if you need to make changes, you can make changes based on some positive feedback.
No, for sure. I mean, just to hop on that publication analogy, I find that a lot of the time when peer reviewers, for example, comment on people's articles, when they lead with something positive, the author receives it a lot better. And I mean, that's not insignificant because then they're a lot more likely to actually make those changes rather than feel like they're just being criticized for no reason. So yeah, I think all of us as humans, we just like a bit of positive sprinkled into it. So
Absolutely.
imagine student nurses are exactly the same. So the second scenario is during a group assignment, you realize that a few members of the group are not contributing equally, and the quality of their work is impacting the overall project. You want to address the imbalance, but you're concerned about creating tension in the group. How would you approach addressing unequal contributions in a group assignment at university while maintaining a positive working relationship with your peers? So, what would you recommend in terms of this situation?
Yeah, and this does happen a lot, and it's the same even when you're qualified. You'll be asked to do some group activities, and some people do more than others. And I suppose it's a very difficult one, but as a professional person, you need to learn very early on that you are responsible for your practice. If there's aims and objectives of an assignment, and there's five people, then typically you'd say, well, there's five learning objectives, there's five people. Why don't we all take one each? Otherwise, what tends to happen is some people will do more work than others. It's a tricky one. I think, when you're looking at theories and you look at things like Belbin's team roles, for example, or thinking hats, personalities do typically have an impact on how we work in groups and teams. So there are natural leaders, there are people that are quiet and reflective. So I suppose that comes with experience. But if you're working in a group, speaking to each other and finding out about each other's strengths and weaknesses or limitations is probably one of the first things I would do. I would say, who wants to feed back to the group? Who's interested in these particular learning outcomes, and then find out which learning outcomes suit which team members. But it might be that some people just don't want to do the work and you end up taking on more. But it says much more about you than it does them, because you want the project to be successful. I would say, just as a point of caution, that people learn at different speeds. And it's important that everybody has a voice and everybody has an opportunity to support a project, but making sure that you work as cohesively as possible, really.
Thank you for sharing that. I think the second scenario in particular is something that definitely occurs not just at university. I mean, that's an issue that people can encounter in any sort of teamwork. So I think hearing your insights on that would be really helpful. But yeah, so that brings this episode to an end. Barry, thank you so much for joining me on the podcast. It's been a real pleasure to talk to you about this.
Thank you very much, Samina. It's been a pleasure to support the podcast, and it's been really enjoyable. So thank you very much.
Thank you. If you enjoyed this episode of Let's Talk Nursing, do follow us for new episodes and share with your colleagues. For more resources and past episodes, visit bjninform.com. Thank you so much for listening, and see you next time.